Hello everyone, this is Dr. Nima and this video is about how would we write or understand or be able to read a prescription. And nowadays, as you know, most of the prescription is written or generated electronically by the computer like we did with Dentrix. But in the same time, we still need to understand and know how it is written and how can we, understand what are the doctor's instructions for the drug that is prescribed. So we're going to talk about a few examples. We're going to take some examples and know about them. Just a refresher, this is how a prescription blank look like. We have a super subscription where we have the patient information, which is here. Technically, that's the doctor information. The patient information here. And then we have the RX, which means seed, and then or recipe, and then we have the inscription. And in this, these things on top, they don't matter because these are easy to do. But now we're talking here. The inscription is the drug name and the strength and the dose. So that is one thing. We have the subscription, which is how much we dispense. And then you have the signature, which is how many times a day they would take and how much, or a week. Okay? So these things will be always there. And as we'll see our example in a minute here, this is our blank prescription paper. And what we want to do is to write the prescription for this patient. So Jane Smith has hypertension and needs a prescription for Vasotec. She will take 5 milligrams twice a day. Vasotec comes in 5 milligram tablets, and she will need a 3-month supply with refill for a year. Okay, so let's break down. That's the address here and all of that. Let's break down. So this is the first part, which is the inscription, the drug name, the inscription, the drug name, and the strength and the type. So when I say type here, in a way, I'm saying like, is it tablet, is it capsules, and so on. So the drug name is here, Vasotec, right? We can put that in here. Vasotec. The strength of each one of these drugs is what, 5 milligram, and the tablets are here, so we can copy this. That's the strength and time, dosage. Right? So that is our first thing. Vasotec, 5 milligram tablets. The dispense and the hashtag would always remain there on the prescription. This is how much or how many we want to dispense for that drug to the patient. And the signature is how many times they need to take it. So for here, they are taking twice a day, right? And we want for 3 months supply. So a 3-month supply is what? How many days? 3-month supply is 90 days, right? And if the patient is taking 2 tablets a day, they need 180 tablets to be dispensed. So that will be enough for them for 3 months supply, right? So again, 3 months supply, and they're taking it twice a day. So how many tablets they need? So we'll multiply 2 a day by 90 days, which are the 3 months. And that will be 180 tablets needs to be dispensed for this patient so that they can have a supply for 3 months. Now the signature, we're telling the patient to take it twice a day, right? So here we're going to go and need to look for these things that we have. So they need to take 1 tablet twice a day. Okay? And sometimes they would add orally to be more specific. So if we want to write that all together, we'll do this. Signature is 1 tablet orally twice a day, right? And then we needed a refill for a year. We gave them the 3 months in advance. Now they have 3 months. Year is 12 months, so they need more 9 months left, right? So they need three refills. Why they need three refills? Because each refill would last them 3 months. So if we're giving them for 1 year, that means they need three more of these afterwards. After the first one, they would refill it 3 times, and this will give them 1 year. It would not be as complicated as this, but this just gives you an example to think about how we're writing it. This is where the dentist would sign. This is the dentist DEA number, and so on. Let's take the second example. Excuse me. So, Joan Smith needs a prescription for eye drops. Most probably definitely that's not in dentistry, but just to play with the, with our work here, so we know how to write it. He uses one drop of Sympotec, which is 0.5%. That's the strength of the drop. In his right eye twice a day. That's how much they need it, and the eye. It comes in 5 cc bottles, the Timoptic, and they need a refill for 3 times. So, first of all, as we know, the drug name, right, and the strength, which is this. So that's the drug name and that's the strength. And we can say droplets or solution in here, but that's okay. Then we need the what? We need the dispense and the hashtag. So how much we're going to dispense? It comes in 5 cc. So that's how much we're going to dispense. Just 5 cc bottle. Then we need to know the signature, which is how many times a day they're going to take it. And we're saying what? They use one drop twice a day in the right eye. So if we go back to here, so let's see, a drop, that is what a drop is, one drop in his right eye twice a day. So this would be our signature here. Again, these might be a little bit more complicated. That will be easy as we go more forward. That is our signature here. One drop in the right eye twice a day. Refill, we said refill 3 times. So here we go. Okay. Now, Bill has a broken arm, needs Lortab for pain. It comes in 7.5 milligram tablets. He should take one tablet every 4 hours as needed for pain. He needs 30 pills, no refills. Okay? So, first thing first, the drug name. So they need what? Lortab. That's the drug name. The strength is what? There. 7.5 milligrams. And tablets, that's the how they come in. Right? We need dispense and a hashtag. And the dispense, we didn't need to count it because it says here 30 pills. He needs 30 pills. So pills, let's get them 30. And then the signature, which is what he needs. One tablet every 4 hours as needed for pain. So, one tablet every 4 hours per needed for pain. That's it. One tablet every 4 hours per needed for pain. So that will be our signature. Right? As needed. So 1 tablet. That's orally if you want to add that, and then as needed for pain. And then we said no refills, so 0 refills. One more. We have Bill's daughter, Emily, asthma, and she needs 3-week course of tapering dose of prednisone. She needs 4 milligrams per day for 1 week, and then 20 milligrams per day for 1 week, and then 10 milligrams per day for 1 week. It comes in 10 milligram tablets, and she get no refills. So the name of the drug first, which is what? Prednisone. The strength, which is this. And then we need what? We need the prescription. Here, well, dismiss. How many tablets we're going to dismiss? Let's count that. So she needs 40 milligrams per day for the first week. So the first week, she needs 4 tablets. So 4 multiplied by 7, right? So for first week, again, it will not be as complicated as this. 4 tablets a day multiplied by 7, which equals what? 28, I'm sorry. Right? And then she needs 20 milligrams per day for 1 week. So the second week, she needs 2 a day by 7, which equals 14 tablets. And then the last week, she only needs 1 tablet per day, which makes it the third week. She needs 1 tablet per day by 7 days, which is a week, which equals 7. Right? So this would equal what? 49, right? 49. He needs to just spend 49. Again, this example is really hard. It would not be as hard as that. But anyway, you can see how I calculated that. The first week, she needs 40 per day. So when we say 40 milligrams, and it comes in 10 milligram tablet, that means 4 tablets for each day for the first week. So 4 tablets a day by 7 days a week. That's the first week. The second week, she needs less, which is 20. So 20 milligrams, which means 2 tablets by 7 days. That's 14, and so on and so forth. So the way that we write that in signature, and again, which most probably we're never going to do this at all, but just to kind of play with this, so you can see that is how much we need to get. Let's get that smaller. So first week, we have 4 tabs each day for 7 days. And then 2 tabs each day, QD, for 7 days. And then 1 tab. And then we said no refill, so it would be no refill. Okay. Now the rest, which are 4 of them, 1, 2, 3, 4, and we also have this at the end of this handout, you will do that, and I'll also give you the right solution. So you can practice on these 4, try to do them on your own, and then see the correct answers afterwards. So you'll have both of these. So for example here, just to kind of give you a heads up, so Tylenol is the drug name. Let's see, this is the strength, right? And then this is the dispensing, 24, and we need 1 T, so 1 pill, every 4 hours or every 4 to 6 hours, which means you can put 4 to 6 hours like that, every 4 to 6 hours. And then by mouth per needed for pain. That is easy, right? Not hard. This one, ibuprofen is the drug name. 4 milligrams, 800 milligrams is the strength. Their tablets, give them 1 every 6 hours, so 1 Q6H. 30 pills, that's the dispensing, and there's no refill. You don't need a refill. We have Adam amoxicillin. That is the drug name. That is the strength, right? And then they need it 3 times a day for 10 days. So that means we dispense 30 because 10 days, each day you give 3. 3 by 10 is 30. And then they need 3 times a day after each meal. So you give one pill, one tea, uh, and then TID, which is 3 times a day, and then after each meal, which is PC, right? So after meals, one pill, 3 times a day after meals. And then the last one, which is augmentin. So Eve needs augmentin, that's the drug name, and this is how it comes in. But she needs 1,000 milligrams. It comes in 500 milligrams. So you need to calculate that to know how many tablets she needs each day. And this is the dispense. That's that. So hopefully you practice with this, and then we can talk together about it. And again, you'll have the correct solutions in there. So this is just for practice. And then, as I said, we'll talk about it, and then I'll give you some kind of a quiz maybe later on, so you can practice on or actually submit it. Well, hopefully that was helpful. I know we kind of have a lot of information, but I think practicing on these would help you a lot. And again, we'll talk about that as well.